Hey there, Naota Hashimoto, Dr. Hashimoto here at Trackstad. I have Eva from One Body. Some of our clients use it. And if you guys verify insurance and you think that's a pain in the butt, and I thought that was a huge pain in the butt because it took us a ton of time, and I knew that it was the bane of her front desk. So she hated that. And so Eva, thanks for joining us today. And I got some questions I want to ask that I think our customers would like to know. But yeah, just give me a little bit about yourself and kind of like how you fell into this solution.
Yeah, I've been in the health space for about 10 years. And so, just in working with a bunch of providers and clinics, like the one thing that kept coming up was just the inefficiencies, of course, of medical billing, but specifically verifying patient benefits. And that was something that, in fact, it's a front office sort of task, I guess, but it really impacts like the back office and billing. And so started looking into it and just talking with a bunch of clinics to see what they currently were doing and what the pain points were and started One Body. And when we started, we were doing everything manually. We were calling the payers, we were using Availity, we were using provider portals. And like our whole mission was basically to decrease the time that it took to verify patient benefits and obviously provide the providers with comprehensive and accurate benefits information.
Yeah, it's quite a bit of stuff. It's honestly confusing being on the provider end, and then I feel like the information you get out of the portals is not very accurate. And then when you call on the phone, you get more information if you get through to them. But sometimes I remember they call and they couldn't get all the information. The person wouldn't give them it all, and they just hang up and they have to sit on hold for another 30 minutes. And like I remember a person that did, she just hated that with a fiery passion. So those are kind of like, and for any of you guys that do insurance, you'll kind of get that. So like your software does a lot of things. I feel like there's a number of pain points that I just kind of listed there. And just tell me about like some of the problems with like some of those portals or the availability and stuff like that when you're doing that. Like what are the pain points and like how are you solving that?
Yeah, as you pointed out, like the information is spread across like multiple platforms and phone calls. And so what we did is we built a product, and we're pretty specific in like chiro, physical therapy, and some mental health as well. And so what our product does is it sits inside your EMR and it gives you or front desk or virtual assistant, whoever's handling like patient registration and appointments and scheduling, you have two options. You can get real-time eligibility, which would pull any information that the payer gives electronically, or you can request for us to call. And in that way, we're providing or we're hoping to provide you with a comprehensive solution to where you have all the sources of information in one place.
So how many people are fine with just doing like the real-time information? I think you do an AI explainer in like layman's terms too to make it.
Yeah, exactly. So yeah, what we do is we plug in with payers. We have direct connections with the payers, and then we also look at some provider portals because we found that certain provider portals have certain pieces of information, like authorization status, for example. So we try and pull that information in as well. And then we give you the 20 or 30 pages that the payer gives us, but we also add that value, like you said, of a summary in plain English with the patient responsibility and any limitations. Again, to save you time and also just provide staff members with a quick way to kind of like understand what the benefits are.
So when would someone say that's good enough versus I need a call?
Yep. So varies payer by payer. Like some payers, there's great information electronically. They release all the information you need. Medicare, for example, is great. They give all the information and it's available electronically. Blue Cross Blue Shield, not so much. You need to call. So it's varies by payer, but
Does
I
it vary by state even too, or is it by pair?
yeah, it can vary by plan also as well. What I always tell providers when I'm talking to them is do the real-time eligibility and look at that summary. If in the summary you don't see anything related to auth or any sort of limitations, it kind of tells you that the payer is not giving that information electronically. And that's when the decision is, do you place the call to the payer to get confirmation, or do you move forward with the information that you have? It's a little bit of like a risk tolerance decision on the provider side. In like the near term, we're trying to work towards making that decision for you by optimizing what is the best route based on the information that we're collecting. So we will eventually be able to tell you for this plan, for this payer, the information available electronically is sufficient for your service type.
That
Or,
sounds like that'd be expensive. Like, how much is that? Like, just for that real-time verification?
yep. Yeah, so it depends on your volume and everything like that, but just like base information for pricing, it's 50 cents per real-time eligibility. And then if you want us to place a call, it's around $7.50 per call.
Pretty cheap. How do you guys make that work at all? It doesn't really make sense.
Well, I mean, for real-time eligibility, we're adding the value of the summary. And then for the placing of the phone call, we do our best to make it so that it's affordable for the practices, but also gives high value. And usually when I'm talking to providers, it depends on their setup. If they're using a virtual assistant, they have a front desk, they're doing it themselves. But the way we've priced is, we don't lock you into anything like an annual contract or anything like that. You're paying per usage. And so it's really helpful to have this tool and use it as you need it to verify patients.
Yeah, like I gotta imagine that if you're having anyone in the US verify it, it's just like a no-brainer, right? And then we had a virtual assistant, but they had a lot of stuff. And I think one of the issues that some offices have when they get a virtual assistant is they don't have enough work to keep them busy. And then you get them trained up, and then all of a sudden they take another job because they got a full-time offer.
Yep.
And that was a mistake I made when I first started with virtual assistants because you train them up. Takes like 3, 4, 5, 6 months. They're going, it's great. And then all of a sudden they take on a full-time job. You're second fiddle. There's always lags and delays for them to get the work done. And then eventually you just end up terminating the relationship and then having to start over. And I made that mistake a couple times because I've been doing VAs for, oh man, like probably since like 2015 at least, maybe even a little bit earlier than that. So I got like in like pretty early compared to where it was. But like, yeah, that was a mistake I made at the very beginning. And I just realized that if you don't give them enough work, they're going to be looking for a full-time job. And as soon as they find it, they're gone. And then you have to start over again.
Yeah,
So,
we've seen that across the board where, practice owners are having a hard time actually like recruiting staff in general. And then what happens is if they hire someone and that person leaves, then no one in the practice might know how to verify benefits. And so that's
yeah.
I do suggest and talk to practice owners about is like this tool allows you to have any staff member be able to understand the benefits and have a tool at their disposal to help them understand, all the
And
patient.
you guys do this all the time. I'm pretty sure like we did it. And then sometimes the person like you're sitting on, I don't know what it's like today, but back when we used to verify, it took like half an hour. And then just to get through to them, if you didn't get hung up on. And then sometimes they don't give you all the things because, like, we had like medical, physical therapy, we're doing bracing, and like we ask for a certain set of codes, and then they give you pushback on like getting all the codes. I'm assuming that if someone doesn't do it all the time, they're going to just take their 1 or 2 codes and then have to call again.
It's the same thing. Nothing has changed on that front. But yeah, what we've done is we've developed our own internal process. So we train everyone internally on verification of benefits and how we do verification of benefits. Like some things we've implemented is we found that if you ask the representative the same question 2 to 3 times, you make sure that they clearly say the answer. That way there's no ambiguity. And then, yeah, we push for certain things if they tell us no.
Yeah.
But yeah, in terms of like the wait times and stuff, that is still the case. You're put on hold and then sometimes the call drops and we just call back.
Yeah, and I've talked to like other like billing people like that actually sit on top of like the EMRs and stuff like that. And I remember I've talked to you and I remember asking like when are they gonna get like actual real-time stuff, but essentially the same answer I keep getting told is it doesn't incentivize Blue Cross or United or Aetna. And is that probably gonna be the case for a long time?
Yeah, like I've heard of a couple of things actually, like, a lot of people are trying to use AI to place the phone calls to the payers, and we've experimented a little bit with that. We haven't found that it's there just yet. But one of the things I've heard that payers are doing is they're implementing technology to detect breathing. And if they do not detect breathing, they're deprioritizing your call. So all the AI calls are going to be put at the bottom, and then the human calls are going to be prioritized. So yeah, I don't know like incentives on there. They spend a lot of money on like the call centers and stuff like that, and everyone has questions around eligibility and benefits, both providers and patients. So it'll be interesting to see what happens and what evolves, but there's always going to be a need for transparency in the health plans, and that's what we're hoping to accomplish. And yeah, if the technology and AI improves, like we will take advantage of that. Um, but yeah, for right now, we use humans for the phone calls just because we want to make sure that we're collecting the right information and that it's comprehensive.
So the moral story is be a mouth breather, right?
Yeah, exactly.
So, well, that's really cool. So obviously, like it would be good for anyone to do this. So, like, I'm assuming even if you have 5 verifications a week or 10 verifications a
Yep.
week, you just pay less, right? There's no
Yep.
reason not to do it. It's not like you're not committed to a certain number of these.
Exactly. Yep. Yeah, for those that have large volumes, we have, monthly plans with discounts and stuff on a per verification basis. But for those, we have some providers, we work with all sizes providers. We have some providers that have 10 verifications a month because they're consistently seeing the same people. We have some that have thousands per month. And so, we try to build a solution that's helpful for any size clinic and just solving the same problem for all of them.
Yeah, and I gotta imagine that you could take those same people that are verifying that are really good team members and just reallocate them to chasing down AR or doing like something else different other than verifications, right?
Yeah, for the on the provider side.
Yeah, on the provider side, like you have someone that's sitting on the phone for, like 6 hours a week verifying insurances. You could take that 6 hours and they could just follow up with attorneys or work comp or insurance companies, and it's got to be a better use of their time.
Yeah, I mean, we found that's why we really like actually working with front desk staff. We usually are training them on the product, and they're so happy that they don't need to wait on hold for 4 hours with Blue Cross Blue Shield, and that our tool provides like a summary and everything they need to know. So I think most people do not love verifying patient benefits, no matter what role they have. And so, we're happy to help with that. But yeah, usually front desk have like there's thousands of things they need to do. So they're plenty busy. And so this helps them, get the information they need quicker and then they can focus on patient experience, calling the patients on the wait list. Like there's so many other things that they have to do. So
Cool. So if someone wants to get a hold of you, what's the best way to do that?
yeah, I will our
We're gonna
website.
have a link in there, but
Yeah, I was
what's
gonna
the
say.
website?
Yeah, I'll provide that. But yeah, email address and link will be provided. But our link is verificationofbenefits.com. Pretty easy to remember. And we can always give a demo of the product live and send any materials for those interested.
Cool. So sounds like pretty much anyone that verifies insurance is a good candidate. And then if you don't do insurance, then obviously probably not a good candidate.
Yep.
So
Any practice that has even some insurance, even if you're doing just Medicare, Medicaid, we cater to all like commercial payers, Medicare, Medicaid.
cool. Well, thanks for joining us. Hopefully some of you guys take action on this. It's a huge time saver and AI automation is here. You can't ignore it. And, it's just only going to save you time, save you money, and less frustration for your patients. So thanks
Makes
for
sense.
coming.